and ends on Saturday 31st this month. Mater Misericordiae Hospital under the Sisters of Mercy have organized a free breast and cervical cancer screening on 18th October 2020 at the Well Karen, first floor, starting from 8 a.m. to 3 p.m. For more information, contact us on 0722 318 149 or visit our website www.materkenya.com. Breast Cancer Awareness Month. Mater Misericordiae Hospital cares. Good morning, dear viewer of Capuchin TV. Welcome on this special interview with me, Maureen Kimani. We are going to continue about Breast Cancer Awareness Month. It's still October month, hashtag October month, hashtag October Breast Cancer Awareness Month. And last week we had Dr. from Mater Hospital, Dr. Wanjohi. And as we continue today, we're going to have another topic, that is prostate cancer. We are dealing with cancer alone. Last week we talked about breast cancer, cervical cancer, and today we shall start on the prostate cancer. But before then, let me introduce my guest today. How are you, doctor?
Hi, how are you doing?
I'm doing okay. How are you?
Fine, thank you. You've been keeping well?
Good to see you.
Thank you. I've been keeping well too, thank you. Yes.
Maybe you can introduce yourself to the viewer.
So my name is Dr. Victor Wanjohi. I'm a gynecologist by profession, but today I'm here to do something called health promotion, to discuss, to make a lot of noise about cancer, because cancer is affecting all of us in the society. Let's all take note.
That was a very good introduction. Yeah. Okay, so before we start, because there is some are joining us right now, they didn't know about what we talked about last weekend. Maybe you can talk about the risk factors of the breast cancer and also the cervical cancer. We can start from there.
So thanks so much, Pauline.
You're welcome.
Last week, you remember this whole month of October, we are making noise about cancer. So sometimes people make noise about other different topics. So October is Cancer Awareness Month. So for this, last week we talked about breast and cervical cancer. First, we started by talking about cancer in general. That many people think that cancer, there are many myths out there. They say cancer is maybe a curse, cancer, somebody did something wrong, or they sinned, that's why they have a cancer diagnosis. However, that is not the case. Cancer cells are forming every day in our bodies, and because of a competent immune system, we are able to deal with the cancer cells themselves before they become a growth, before they are too big to be unmanageable. Next, we went to breast cancer. We said, why are we making noise about breast and cervical cancer? Because somebody should go for screening. If it is found when it is small, then the cure is also small. It's not big. So let the viewer know that if cancer is detected early, especially of the breast and of the cervix, the care which is needed is very little, and the person is able to continue their life as if they didn't have cancer.
Yeah, very true. And maybe you can mention maybe 2 or 3 about the risk factors of the breast cancer.
Yes. So we say that for breast cancer, just like with other cancers in general, there are modifiable and non-modifiable risk factors. So modifiable means somebody has that opportunity to prevent themselves from getting that cancer. But non-modifiable means no matter what they do, some things predispose them to getting cancer. So one of them is age. So the older someone is, the higher the risk of breast cancer. Number 2 is family history or genetics. There are some people who in their family lineage, they have a family history of breast cancer. So even them, they are at high risk. Now, for the modifiable, we touched on diet, eating so many fatty foods and so many animal proteins, like eating meat. Every day somebody wants to eat meat. Somebody is always eating junk food or fast food. Then they are at risk of getting cancer of the breast. Number 2, we said against smoking.
Yeah,
And taking alcohol.
Yeah, for the youths out there, I hope you're listening to this. Be taking notes.
Yes, so somebody can start when they're 18. Maybe they are smoking. They are saying after 2 years I'll stop. But maybe in those 2 years they've put something else which is going to push them towards getting cancer. So even the one who is just starting to smoke or starting to drink, let them know that they are putting themselves at risk from today, not from yesterday, not from tomorrow, from today.
So they start a new life?
Yes.
Okay.
Yes.
And maybe we can talk about maybe the cervical cancer, the risk factors.
So we said that cervical cancer, with cancer diagnosis, is multifactorial. There are many things that put someone at risk for getting the cancer. For cancer of the cervix, number one is human papilloma virus, which is spread as a sexually transmitted infection. So it's so important for somebody to know when they begin their family, that time is the time that they are going to start putting themselves at risk of getting this cancer of the cervix. Okay. Number two, we said that, again, smoking. Non-modifiable risk factors. Smoking. There are some medications which can put somebody at risk. Okay, so as somebody goes to the hospital for the routine checkup, they should find out which are these medicines I'm taking and can they put me at risk of catching cancer of the cervix. Next is having now those illicit relationships. Having so many friends, remember this is a sexually transmitted infection. So when you have so many friends, then somebody is at risk. Then somebody who maybe is trying to live a holy life, let them try to live a more holy life.
Okay, thank you about that. So we were talking about the recap of our last week topic, that is breast cancer and cervical cancer. And now we're going to move on to our today's topic and talk about prostate cancer, which is commonly affects the man, the boy child. And so maybe you can say what is the meaning of the prostate cancer and maybe where it's located and the main cause.
So it's so nice you've said that, because last week we were looking at the girl child.
Yeah.
And because we are doing a 1/3 gender rule, at least now this week should be the day for the boy child.
Very true.
So for the boy child, men are the only ones, or boys are the only ones with a prostate. So ladies cannot get prostate cancer. It is not possible. So the prostate is a gland which looks like the size of a pea. A pea, I don't know what is. I don't know how to put it in Kiswahili, but PEA, the one that you say peas in a pod, or maybe black-eyed peas, or beans. I don't know.
You got it.
So it looks like a pea, very small, and it's located at the base of the bladder. At the bottom of the bladder is the prostate. So you can see the prostate is carrying the bladder. Between it travels the urine as it is coming out in the middle of the prostate. This is important because we are going to look at the symptoms of prostate cancer and see how they are related with the urinary system. Okay. So it's under the bladder. It's related with the flow of urine. Then number 3, the function is to produce a fluid which helps the sperm to be able to swim. It gives the sperms energy so that they can be able to swim. When the sperms are located in the testes, they are not swimming, they are quiet, they are dormant. They are like a dormant volcano. Now, once the sperms mix with that prostate fluid, it gives them something called fructose, which is a kind of sugar. So they get energy to move, to be able to go and fertilize the egg during the process of conception. So that in a nutshell is the prostate. Where is it located? and what function is it to a man's body. So it's very important for the men.
Maybe you can explain before you continue, what is the work of the prostate in a man's body?
So we said it's producing a fluid to help the sperms to be able to swim faster, to go and cause conception. When the sperms are in the testes, they are not working. They are dormant.
Okay.
Yes. So they are going to be capacitated. They'll be enabled to swim to go to fertilize the egg.
And maybe why is cancer of the prostate so important? Because we say that breast cancer is the first one, and then we have cervical cancer, and then prostate, that is the third one. So why is it important for the prostate cancer?
So that's a very good question. So why is this cancer so important is because the prostate, it's easy for us to screen for prostate cancer. So even for a man out there without any symptoms, they can be able to know what is my risk of getting cancer. Maybe, okay, this year I don't have, but next year could I have?
Yeah, you don't.
So they can be able to do the screening. So, and that is why we are making so much noise. Maybe if Daktari or somebody else has cancer, maybe in the brain, maybe we've not developed a test, a cheap test or an easy test to do to diagnose cancer in the brain. So that one, until the symptoms come, too bad.
Okay, and maybe what are the risk factors of the prostate? The age, and does it vary depending on the the breast cancer?
Yes, so just similar to breast cancer, the incidence of prostate cancer increases throughout a man's life. The risk starts increasing from about 40 years of age, and then by the time somebody is maybe 100, 105 years, almost 90% will have cancer of the prostate. Now, the beauty about this cancer is that it is slow growing. So only a few of those men who have prostate cancer will have any symptoms. Majority, actually what research has shown is that when they check men who have maybe passed away for other reasons, so they do they check the prostate, they will find as somebody ages, more and more of the prostate, they have cancer cells, even though the men did not have any symptoms whatsoever. So that is something also very important for all the men out there to learn, that for all cancers, initially when they start, there will not be any symptoms. So we want to detect before the symptoms begin and offer the help at that time.
And how common is the cancer of the prostate? How common is it,
So the cancer statistics in Kenya, they are not very clear, but globally, it's among the common cancers in the world. Yes. In Kenya, for men, it is the commonest cancer. You see, for maybe, because this is a cancer which is only in men. For maybe, let's say, in the general public, there are other cancers which are more in the number, but for men, prostate cancer is number one, affecting men only. So, and why is this? Because they are the risk factors. The risk factors include age. So this is non-modifiable. Next year, I will be older than I was this year. So I'm more at risk next year of getting cancer of the prostate than this year of getting cancer of the prostate. Number two, now we go to modifiable. So again, I go back to this one for the lips, this one, smoking. So we don't recommend, stop smoking. Number three, obesity. Again, and also a lifestyle of eating so much animal protein, so much junk food, fast food. Let us avoid. Those are things which we can avoid.
And what do you think about the race or ethnicity? Does it also affect?
So what they say is that majority of cancer, they affect low socioeconomic status. Someone who is not maybe, or who is not seeing the need of going for screening. So you find in quotes, the poorer countries will have a higher risk of the cancer forming. The richer countries will have a lower risk of the cancer forming.
Okay. I think we're going to take a very short break so that when we continue, we're going to talk about how to prevent this prostate cancer and also the myth. I know you have so many questions and you want to learn about more. So let's take a very short break. We'll be right back.
October being a Breast Cancer Awareness Month, Misericordiae Hospital is having a free breast examination throughout the month at our main hospital and all our medical centers. Take this opportunity to have your breast examined and learn more about breast cancer, how to do breast self-examination, mammography, breast ultrasound, fine needle aspiration, treatment and side effects, recovery and renewal. Our mammogram, breast ultrasound and pap smear charges have been drastically reduced through this month. Mammogram is at 2,500 Kenya shillings. Breast ultrasound is at 3,000 Kenya shillings. Pap smear is at 1,500 Kenya shillings. The schedule of screening centers will be as follows. Main Hospital, Monday to Friday between 7 and 10 a.m. Buruburu, Monday between 8 and 1 p.m. Development House, Tuesday between 8 and 12 noon. Karen, Monday to Friday between 8 and 12 noon. Westlands, Monday to Friday between 8 and 12 noon. Thika, Monday and Friday between 8 and 10 a.m. Kasarani, Tuesday and Wednesday between 8 and 10:30 a.m. Shujaa, Wednesday and Thursday between 8 and 12 noon. Did you know that women aged 30 years and above are at a higher risk of breast cancer and are encouraged to attend? Please share this information with your colleague, friends and relatives. Mater Hospital Breast Clinic runs every Wednesday between 9 and 11 a.m. Please contact us on 0732 163 132 or 0719 073 132 to book an appointment. Mater Misericordiae Hospital cares.
Kipaimara ni sakramenti yenye kumpa Mkristo Roho Mtakatifu na ukamilifu wa mapaji yake 7, kumfanya Mkristo mkamilifu na kumfanya shahidi hodari wa Yesu Kristo mpaka kufa.
Kupata kipaimara kama skiza tune yako, tuma neno skiza likifuatwa na nambari 738100272 kwa 811. From KCCB, Pontifical Mission Societies, join Capuchin TV on Saturday at 7 p.m. as we deliberate on missionary apostolate in Kenya. Here I am, send me. From Capuchin TV, we wish you a happy Mission Sunday.
Guys, and it is a topic and a discussion about prostate cancer, and we shall continue. But before we went for the break, we were talking about the risk factors of the prostate cancer, and we're discussing about the ethnicity. Maybe you can take it from there, Doctor.
Yes, so we are saying that the poorer countries, because they are not going for screening. So the poorer countries, the poorer peoples, the people who prioritize other things instead of their healthcare, then they are going to get more cancer. So you will find it's more common in blacks. In us Africans, we'll have higher risk of prostate cancer than wazungus out there.
Okay.
Then another thing is about family history or genetics. Some people are just genetically like that then they will develop prostate cancer in their lives. So it's so important, especially because this genetics, like maybe when you're born, you don't know your DNA and what is your risk of developing a cancer. So this brings the importance of screening. Let all men above 40 to go for screening to avoid saying maybe our family, there's nobody who has cancer of the prostate. Maybe you could be the first one who is going to start a new line of cancer in the family. So go get checked.
That's why we're having these, and we are creating awareness so that you can go, be screened, and know yourself. It's always good to know yourself, right?
Yes,
Yeah.
yes.
Okay, maybe you can talk about what are the common signs and symptoms that can help to diagnose.
Okay, so before that, I'd like to take a small detour that there is something else. The prostate, remember, the prostate is associated with urine, with the passage of urine. Okay, so anything affecting the prostate can have urine symptoms, including cancer. So it's so important, again, a man is developing these symptoms which I'll mention. It does not mean that this is cancer. Until we screen you for cancer, we cannot say that somebody has prostate cancer. So the symptoms will be related with passing of urine. So one, when some blockage of the passage of urine. So number one, when somebody goes to pass urine, it takes a long time to initiate the passage. So they've gone to pass urine, they're in the toilet, but even after 1 minute, nothing is coming out. Now number two, when it starts coming out, it will not have a good flow. It won't empty quickly. It will come out slowly, maybe drop by drop by drop by drop. Then next, when somebody is going to finish to pass urine, it will now again come out drop by drop. It's not finishing to pass urine. The person is staying in the toilet for 5 minutes, 10 minutes, only to go for a short call. Now, when they leave the toilet, again they'll feel, I still have some urine left. So, all the time, that person will be going to the toilet for 10 minutes. After 1 hour, they are back in the toilet again for 10 minutes. So even people at home, because now these are our grandfathers, our great uncles, they're the ones who are going to have these symptoms. Us as their children, as their juniors, let us also observe them. So this, my relative is always going to the toilet, always going for short call, never, yes.
And being interested to know what do they go to them, what's happening.
Yes, what is happening. Now, when they go to sleep, they cannot sleep for long, the 8 hours. They'll always be again going to the short call. That is called nocturia. In case they get an infection, they can have pain when passing the urine, maybe passage of things like pus or blood through the urine. Now, finally, is that these symptoms will bother them. So this old man in the village does not want to admit, but actually he is concerned that all the time at night, I'm waking up 5-6 times to go to the toilet. Kweni ni nini hii imekuja? But many men, you know, as men, we are another special group. So many men don't want to go to hospital. They want to wait with their problem until when they are very sick, that's when they go to hospital. So all the children out there, go and inquire. Go and ask your fathers out there, can you go for screening? Another point.
Okay, and we want you to differentiate about there is the prostate cancer and also the prostatic enlargement.
Thank you so much. So it's so important for men to know outside there that not everyone who comes with those symptoms has cancer. Okay, so let them go for screening. There's something called benign prostatic enlargement. This is a non-cancerous enlargement of the prostate. Because of the male hormone called testosterone, above the age of 40, the prostate begins to become bigger and bigger and bigger. So as it's growing bigger and bigger, it's making the passageway for the urine narrower and narrower and narrower. So the symptoms will present similar between when it's prostate cancer and when it's benign prostatic enlargement. Both of them, can be potentially serious. Even for the benign one, if it blocks the urine flow completely, it can cause renal failure, kidney failure, which is very serious. So even anyone with symptoms, let them go for screening.
Okay, and as we see, for the breast cancer, most of the time we treat with the surgery. Is it the same case that happens to the prostate cancer? How do you treat?
Yes, so for prostate cancer, once we've done the screening and we've confirmed that it's cancerous, then we offer treatment.
Okay.
If the cancer, okay, let me say, unfortunately, majority of the men, because they are going to come to hospital late, it will be they'll come with an advanced cancer, which a lot of the time is in the spinal cord, a lot of the time is in the lungs, is in the liver, is in the brain. So the treatment there is called palliative treatment.
Okay.
But had this man come earlier, maybe we screened and we found even without any symptoms, then we do surgery. The surgery, we don't cut anywhere. It's offered at the Mater Hospital. We go through the urine system, and then we cut the prostate and the part with the cancer out. Now, it means somebody will heal without any scar. They won't have any issues with passing urine or with even the other normal acts.
Okay, and maybe we always say that any type of disease, it's always have, and you are told by the doctor you have to eat healthy, you have to do exercise. How do you go about maybe how to prevent the prostate cancer for the men?
Yes, so for prostate cancer, we said they were non-modifiable and modifiable. So stop smoking, reduce your intake of alcohol, eat more fruits and vegetables. Now, with fruits and vegetables, there is one particular vegetable which I'd like to sing about, a song about. It's called tomatoes. Sindio? Or nyanya.
Yeah.
Sindio? So, tomatoes, especially in their raw form, when they are ripe, they have something called lycopene. Now, lycopene is, if it's high in the body, prostate cancer, kuisha. Prostate cancer, stay away. So, all the men out there, you should not neglect eating kachumbari. You know, the men are going to go maybe and buy nyama choma, and then they'll say, usinieke kachumbari. Sindio, especially during this time, we are not very sure about, there are so many diseases out there, such as cholera and what and what. So now, let them eat their kachumbari.
So it's not a myth that taking of tomatoes is good for the prostate. It's not a myth.
It's not a myth.
So it's true.
Yes, all men to eat tomatoes.
Nyanyas.
Tomatoes for lycopene. Or nyanyas.
Okay, how about you say, is it staying long with the sperms in the body makes them rot and cause cancer?
Yes, so there are many myths out there about prostate cancer because the prostate is associated with reproduction. So there's that myth that if somebody stays with the sperms in their body for too long, then they will rot and then they increase the risk of cancer. However, this is not true.
It's not true.
This is a myth.
Okay, and also I have another question. Can a man continue with his sexual life with and after prostate cancer?
So, if somebody has prostate cancer, it can affect the nerves. The nerves for maybe reproduction are near the prostate. They travel next to the prostate. So if we do a surgery, especially a very radical surgery to remove the prostate cancer, it can affect somebody's family life, that they won't be able to engage in their family acts.
Okay.
Yes.
Thank you so much, doctor. And maybe someone has a question you want to know more about, you can give out maybe your details. You can also tell them about the 18th of October. You have the screening and creating awareness. You can talk about it.
Yes. So you know something, Maureen, you know us, we are neighbors, eh? We are just here next to you people. Sindio?
Yeah,
yes, so we are located at the well, Karen. There is Mater, the well, which is in Karen. But we also have the different satellite branches, And we also have the main hospital in South B. Now this branch of ours, the well, tunaipigia debe sana. Why? Because you will have prostate cancer checkup, breast cancer checkup, and cervical cancer checkup. And these ones we are offering at subsidized rates and even free for some of the tests. So the best is go there, take 30 minutes, go learn more about your body, because this is what is going to give you either a long life or a short life, either good health or poor health.
Okay, thank you so much, doctor, for coming. And you know, they always say, I have a small saying from Newton Lee, information is power and disinformation is abuse of power. I hope you are going to take a note and have a food for thought on that. Thank you so much for coming. Thank you for creating awareness. It has been a good time. Thank you so much. I hope we're going to have more topic, maybe more discussion about this.
I'll be looking forward to coming in the future so that we discuss, because let's know about our health. And the more healthy we are, the more productive we'll be, the more Kenya will be successful.
Very true. And I've enjoyed being with you and talking with you and knowing a lot. I hope you're going to make sure I create awareness, help your friends, your brother, make them and learn about prostate cancer. Thank you so much. I am Maureen Kimani, and my guest has been
Dr. Victor Wanjohi, representing Mater Hospital.
Very true. I hope you're going to have a blessed day ahead. Did you know that Breast Cancer Awareness Month started on Thursday, 1st October and ends on Saturday, 31st this month? Mater Misericordiae Hospital and the Sisters of Mercy have organized a free breast and cervical cancer screening on 18th October 2020 at the Well Karen, first floor, starting from 8 a.m. to 3 p.m. For more information, contact us on 0722 318 149 or visit our website www.materkenya.com. Breast Cancer Awareness Month. Mater Misericordiae Hospital cares.